Hey there, health enthusiasts. Welcome back to my channel, and today we're diving into a topic that you've probably heard about during your doctor's visits. The CBC test. What is it? Why do doctors always recommend it? And what are all those parameters they measure? Let's get into it. First things first, what does CBC stand for? CBC stands for Complete Blood Count. It's one of the most common blood tests ordered by doctors. But why is it so popular? Well, the CBC provides a wealth of information about your overall health by measuring different components of your blood. Let's break it down. The CBC measures three main types of cells in your blood. One, red blood cells. These cells carry oxygen from your lungs to the rest of your body and return carbon dioxide back to your lungs to be exhaled. White blood cells. These cells are part of your immune system and help fight infections. 3. Platelets. These are tiny cells that help your blood clot and stop bleeding. So when your doctor orders a CBC, they are looking at several key parameters for each of these cell types. Let's go through them, starting with the red blood cells or RBC count. The RBC count in a complete blood count or CBC test measures the number of red blood cells in a specific volume of blood. Red blood cells are crucial for carrying oxygen from the lungs to the rest of the body and bringing carbon dioxide back to the lungs to be exhaled. It helps diagnose conditions like anemia. Then we have hemoglobin. Hemoglobin or Hb is a protein in red blood cells responsible for transporting oxygen from the lungs to the body's tissues and returning carbon dioxide from the tissues back to the lungs. It is a key parameter measured in a complete blood count CBC test. Low levels can indicate anemia. Next we have hematocrit. Hematocrit or HCT, also known as packed cell volume or PCV, is the proportion of blood that consists of red blood cells. It is expressed as a percentage and is a part of the complete blood count test. Hematocrit is an important measure because it helps determine the blood's capacity to carry oxygen. It also helps diagnose anemia or dehydration. Then we have mean corpuscular volume. This measures the average size of your red blood cells. It can help determine the type of anemia you have next. There is mean corpuscular hemoglobin. Mean corpuscular hemoglobin or MC is the average amount of hemoglobin, a protein that carries oxygen in each red blood cell. Next, the white blood cells. This is the total number of white blood cells. High or low counts can indicate infections, inflammation, or immune system disorders. This breaks down the different types of white blood cells. It includes neutrophils, lymphocytes, monocytes, eosinophil cells, and basophils. Each type can provide clues about specific health issues. This is the number of platelets in a volume of blood. Low levels can lead to bleeding disorders, while high levels can increase the risk of clotting issues. Then there is mean platelet volume. This measures the average size of your platelets. It can give insights into platelet production in your bone marrow. The next time you see all those numbers on your blood test report, you'll know exactly what they mean. Remember, if you have any specific questions about your CBC results, always consult with your doctor. Thanks for watching. If you found this video helpful, give it a thumbs up and don't forget to subscribe to my channel. Stay healthy and see you next time.